Welcome back to Creating Dementia Solutions. I'm Richard Pyatt. This is a Miles for Memories program, and we're thrilled you found it. Whether it's on Access Vision, on YouTube, as a podcast, BattleCreekPodcast.com has all those episodes, as does YouTube. And we invite you to click the like button on the Miles for Memories Facebook page so you know when these episodes come around. Sherry Sherbin is back with us this time with some updates from Miles for Memories on a number of things. In this particular case, we're going to talk about the question, what's next? Hi, Sherry.
Well, hi, Richard. It's always a delight to chat with you.
Well, I'm happy that you're here, and it helps that you were already here for your show, and then I can just slip right over and we can talk about these things. But the idea behind the question, what's next, is something that you've studied.
Yeah.
And now there is some documentation that you can pick up that can help folks answer that question. What are we really talking about?
Well, you know, when a family member is going through experiencing their loved one maybe behaving in a way that's different from normal, there's always that question, is it just a good day, not a good day? What am I doing? Am I overreacting? And really the first best thing for anybody to do is to seek out a diagnosis. And when I say that, I think one of the things that becomes important in this process is that the assumption is I'm telling you to go get a diagnosis for dementia, when in reality, there are a host of reasons why someone may act as if or exhibit the symptoms of dementia and it not be that at all. And so when you go to the doctor, you start explaining things, they're going to test for a variety of different things, and then they're going to say, you know what, we really just have an infection we need to deal with. Let's take care of the infection, get it off the table, and guess what? 10 days later, mom or dad is behaving in the way in which they normally have been for years upon years upon years. And so part of the frustrating part of that is going to the doctor's office, you're hoping to get a diagnosis today, and that doesn't happen. It takes sometimes several visits so you can start ruling other things out first before we take steps in that new direction. So it all starts with that diagnosis and that patience through the process of determining why the symptoms that they're exhibiting are there at all.
And then responding accordingly.
Right.
Yeah.
Yeah.
And so this card, I was going to call it a new card, I guess it's new, fairly, is trying to help folks understand that facts are important. So let's figure out what they are first.
Yes.
But then it continues in such a way that one is dealing with a dementia diagnosis. So now what's next? Is that the point?
Yeah. So, you know, that one of the big things in this whole process is now starting education. Learning more about what that diagnosis means, learning about how things are going to transition, knowing what to look for, learning that the behaviors that maybe you're seeing are not intended to be annoying you. They are not intending to be obnoxious. They are moving through the process. And you knowing that ahead of time can be really helpful in the way in which you put things together, the way in which you then respond to them, and knowing the best way, learning through that, the best way to respond to them to make sure that they're able to accomplish the things that they still can.
That's important, and certainly worth noting that these steps that you've tried to articulate on this card could simply be the reference guide someone needs to understand some of the things they should consider, if not all of them.
Right. You know, and you don't necessarily even have to do them in this particular order, right? You start working through them in the way in which works best for you, for family members to be able to do that. But, you know, a diagnosis has to come first, right? And then start learning, and then start determining what your resources happen to be able to move forward, one of which is families and friends. So being willing to recognize that if you have a support system, this is going to be easier on everybody, and your loved one will get the best care that they can.
So some of the points that are made here, let's just talk about them briefly, as you've started to do, connecting with friends and family, finding a support group for the caregiver.
Yeah. So that particular opportunity not only helps you with continuing your education, but it also gives you a safe place to be able to vent some of your frustrations and then learn from the others in the room to say, if you just did this, this, and this, the whole thing goes so much faster. And there's a lot of aha moments that happen when one caregiver shares this with another, and it is a new group for them to really bond with and move forward with. So it becomes very important to that caregiver to have others that they can rely on, even outside of the family, when you move forward with this.
Then there's legal documents.
Yeah.
Small thing.
Depending on where we're at in the progression of things, there is that unusual situation where you might get a diagnosis the first visit, right? But oftentimes we're ruling things out in the process of getting there. But we need to put legal documents in place at a time at which the individual that we're most concerned about has the cognitive ability to sign those legal documents. So in some cases that might need to move really close to the surface if that's still a possibility. And if it's not a possibility, then there are other ways around to put some legal ramifications in place in terms of who can do what, who can deal with their finances, which is another one of the bullet points on here, to make the best steps forward in the best interest of your loved one.
Yeah, that is the next one, evaluating finances and perhaps community support for that. Something else here is establish ADL support. What does that mean?
Those are activities of daily living. So in your household, maybe somebody's really good at cooking, so Aunt Pat always comes in and cooks dinners for 4 days out of the week. Or maybe Joey's really good at chatting, so Joey comes every morning for coffee and it spends just a few minutes doing that. Maybe Julie likes to plan things, so she works on the calendars for everybody's events throughout the year, or activities throughout the week rather, and then obviously further on into that, managing that. Somebody to manage who's going to deal with the finances and make sure that those things happen. So ranging from real technical things like dealing with finances to the more social and emotional kinds of things really help to move this whole process along, and planning that, all the activities. And if you don't have somebody to do that, then there are agencies here in town that can help support that. So whether it might be Carewell Services as an example, and some of the programs that can be put in there, community living supports might be another one of the programs that Senior Health Partners will come in and provide through funding that comes in through Calhoun County Senior Services. So if you don't have that, having that resource to reach out to say, how do I put all this stuff together? So you can give us a jingle over at Miles for Memories, and we can help give you some additional resources in terms of how you might move to the next step in any one of these 12 situations.
Right, and I can imagine that someone, as nice as this is laid out, for folks to say, okay, here's the steps, right? But a person could look at this and be like I am in front of all the paint chips at the hardware store. Like, wow, it's just just too much.
Yeah.
That's a good point to make, that they don't have to stare at this and try to figure out what's next on their own.
Yeah.
You're there.
We are there. Even healthcare support and providers, the thought is that, we're really just looking at their journey through some level of dementia. But you know what? We don't stop with just dementia. We want to make sure that vision is taken care of, hearing is taken care of. If we have another, heart disease, that's being taken care of. Any other chronic condition is monitored, from blood pressure to cholesterol. All of that needs to happen. And oftentimes we have different physicians that are helping us through each of these different processes. Right? Somebody has to manage not only where we go for healthcare, but how we get there, right? Transportation is just as important in this whole process.
If we talk about the person or selected few who might be managing this list for someone, they might be dealing with their own health challenges and things of that nature, and thus it adds more pressure on top of this. You've probably encountered that.
Oh, yeah, most definitely. And, we talked about just a moment ago about that support group, but the support group becomes really instrumental in helping them recognize maybe some other ways of expanding in each of these areas that maybe they didn't think of on their own. So Miles for Memories, as an example, later in the year has the caregiver retreat. It is simply for the caregiver. It is a moment to get away, to focus on yourself. It can be learning in that day. It can be massage in that day. It can be engaging with others and just having a moment of socializing in that day. That caregiver retreat is to focus on them and not anything else. And we will provide supports if they have difficulty with finding a place for their loved one during that time. We'll help with that as well. So
that's very something very significant to consider, isn't it?
Yeah.
I can't be there. I have to help.
Yeah, right. So respite, this is a moment of respite at the same time for them, that brief time that they'll have that's 4 hours, which is significant for somebody who's having a hard time figuring out when they're going to drink their coffee.
Mm-hmm.
Yeah.
I presume that you developed this card because you recognized that there was a moment for folks after the diagnosis happens, a moment of overwhelming feelings, and maybe a moment of inaction, right? I'm overwhelmed, I can't think about it right now.
Yeah.
This helps them think.
Yeah.
I mean, tell me if I'm wrong.
Right.
It sounds like that.
Very much so. And 12 simple little things, which can be expanded and will be expanded in a whole lot of different areas. But if you can just think of it in bullets instead of thinking it in paragraphs or stories or whole other books that you need to read to get started, this simplifies it, right? So, we do have the companion Remember When guide for understanding dementia. It does address several of the components on here, but we are also in the process of putting together a particular piece that very specifically says, okay, education, where do I go? Legal documents, where might I go? What are those resources that are available at no charge? What are those resources that might be available for a fee? So in our community, we are so blessed with programming that is available in Calhoun County that for those that qualify can get many of these things at no charge.
Wow. That would be terribly helpful, wouldn't it?
Yes.
So really understanding the steps broadly and then trying to create some additional information that does get in depth if that's what you need.
Right, yeah.
But also, here's where you can go. Boy, sometimes that's all we need to know, isn't it? What do I do now? Where do I go? Help me figure that out.
Yeah. And one of those that is constantly changing is really what your housing options are, right? So maybe today you're starting in your home. There's a lot of autonomy that is still there, and we want to encourage that for as long as we possibly can. And then maybe we start bringing in some supports to continue to support you in that environment. And at some point in time where you can't get enough supports all day long, maybe we do need to move to an assisted living facility, or maybe we do need to move to a facility that also offers additional supports for a person living with dementia. And then finally, we may end up in a skilled nursing facility as things progress, as the disease process does. We don't have a cure yet, so there's a transition, and family members can see that transition clearly, or at least be willing to say, this is what's going to cost me for 24-hour care.
You ever run into folks who can't get past the first bullet point? That is to say, they do have this moment of, paralysis, I guess, and they can't get past that.
Yeah, we have come across many that have not even been willing to identify that the symptoms that mom or dad are living with right now might actually be dementia.
Yeah, that's tough.
Right? That's just mom. That's the way she is. She's behaved like this for years, and when you begin to recognize that. If we can acknowledge it as dementia, there's additional supports and medications that maybe we can bring into the system that could benefit them. But when you completely just disregard it, close your eyes, you miss out on those potential opportunities.
Meanwhile, the condition could continue to progress.
Yes, it will.
And what happens then? You're going to cross a threshold where additional help is needed and can't really deny it anymore.
Yep.
That's probably harder than trying to acknowledge what's happening.
Yeah. And while it doesn't say it directly on here, two of those things that becomes most important in this process is also looking at continued movement, continued engagement, and balancing nutrition. and medication management. So those 4 are really incorporated into all the different components, because sometimes it's somebody managing it for you. Sometimes you're still able to manage part of those things on your own. But we can clearly see that the longer someone can be active and engaged, the more impact that it's going to have on the other end. Yeah.
The Miles for Memories tip card, how do we get it, Sherry?
Well, certainly you can always give us a jingle over at Miles for Memories at 269-979-1412. Again, 979-1412. Or just reach us at the website. You can send us a note there, send us a note on Facebook. The website is under its next revamp, so all of our new materials will be uploaded into it. As soon as our research update video is all done, we'll have connections to the YouTube channel and obviously the podcast and everything directly from the website. So we're going through a few updates on that, but you'll be able to gather any of these here or stop by the office, right? Or I'll send it out to you. It's that easy. Yeah.
979-1412 is that number. milesformemories.org is the website as well to get the tip card. And as Sherry said, pretty soon, all of those resources. Thank you, Sherry.
Well, thank you.
Sherry Sherbin is the founder of Miles for Memories. She'll be with us in our next episode. We're going to talk about some exciting developments that have been happening associated with the Miles for Memories mission. Meanwhile, she mentioned Facebook. Make sure you click the like on that so you know when these episodes come about and other information pertinent to Miles for Memories and perhaps you are easily found. I'm Richard Pyatt. Back with you again soon.